Question 1. Which of the following is the brand name for atorvastatin? A. Zucker. B. Lipitor. C. Crestor. D. Pravachol. Answer B. Lipitor. This question tests your knowledge of common brand and generic drug names, a fundamental skill for pharmacy technicians. Atorvastatin is the generic name for Lipitor, a medication widely prescribed to lower cholesterol levels. Zocor, simvastatin, Crestor, rosuvastatin, and Pravachol, pravastatin are other medications in the same drug class, but they have different generic names. It's crucial to know these pairings to prevent medication errors, like accidentally dispensing the wrong statin to a patient. A helpful tip: many drugs in the same class share similar-sounding generic names, but their brand names are typically distinct and unique. Question 2. A patient is prescribed metoprolol tartrate 50 mg twice daily. What drug class does this medication belong to? A. ACE inhibitor. B. Calcium channel blocker. C. Beta blocker. D. Diuretic. Answer C. Beta blocker. Understanding drug classes is essential for recognizing a medication's purpose and potential effects. Metoprolol, whether tartrate or succinate, is a beta blocker, a class of drugs primarily used to treat high blood pressure, angina, chest pain, and heart failure by blocking adrenaline's effects on the heart. ACE inhibitors, like lisinopril, calcium channel blockers, like amlodipine, and diuretics, like hydrochlorothiazide, are other common blood pressure medications but function through different mechanisms. Remembering that drugs ending in olol are often beta blockers is a great way to quickly identify their class. Question 3. What is the generic name for the antidepressant Zoloft? A. Fluoxetine. B. Citalopram. C. Sertraline. D. Paroxetine. Answer C. Sertraline. This question checks your ability to connect common brand names with their generic counterparts, which is vital for accurate dispensing and patient counseling. Zoloft is the brand name for sertraline, a widely used antidepressant that belongs to the selective serotonin reuptake inhibitor (SSRI) class. Fluoxetine, Prozac, citalopram, Celexa, and paroxetine, Paxil, are other SSRI antidepressants, but they are distinct medications with different brand names. Mastering these common brand generic pairs will significantly improve your efficiency and accuracy in the pharmacy. Question 4. Which of the following medications is a common selective serotonin reuptake inhibitor, SSRI, used to treat depression and anxiety? A. Duloxetine. B. Venlafaxine. C. Escitalopram. D. Bupropion. Answer C. Escitalopram. This question assesses your knowledge of specific drug classes and their common members. Escitalopram, Lexapro, is a widely prescribed selective serotonin reuptake inhibitor, SSRI, known for its use in treating major depressive disorder and generalized anxiety disorder by increasing serotonin levels in the brain. Duloxetine, Cymbalta, and venlafaxine, Effexor XR, are serotonin norepinephrine reuptake inhibitors, SNRIs, while bupropion, Wellbutrin, Zyban, has a unique mechanism. Recognizing that SSRIs often have names ending in pram or ine can help you categorize them quickly. Question 5. The generic name for the antibiotic Zithromax is A. Amoxicillin. B. Azithromycin. C. Cephalexin. D. Doxycycline. Answer B. Azithromycin. This question tests your recall of brand and generic names for common antibiotics. Zithromax is the brand name for azithromycin, an antibiotic frequently used to treat various bacterial infections, including respiratory and skin infections, and sometimes sexually transmitted infections. Amoxicillin, cephalexin, and doxycycline are other antibiotics, but they have different generic and brand names. It's important to differentiate these common antibiotics because incorrect dispensing can lead to treatment failure or adverse effects. Question 6. What is a common side effect of lisinopril? A. Constipation. B. Dry cough. C. Blurred vision. D. Muscle pain. Answer B. Dry cough. Knowing common side effects helps pharmacy technicians anticipate patient questions and identify potential issues. Lisinopril, an ACE inhibitor used for high blood pressure and heart failure, is well known for causing a persistent, non-productive dry cough in some patients. While other medications might cause constipation, blurred vision, or muscle pain, these are not typical side effects specifically associated with lisinopril. If a patient reports this cough, they may need to switch to a different class of blood pressure medication, like an ARB, angiotensin receptor blocker. Question 7. A patient picking up a prescription for omeprazole should be advised that this medication is primarily used for I. High cholesterol. B. High blood pressure. C. Acid reflux/GERD. D. Bacterial infections. Answer C. Acid reflux/GERD. This question focuses on the primary indication for a very common medication, which is key for proper counseling. Omeprazole, Prilosec, is a proton pump inhibitor, PPI, that significantly reduces stomach acid production, making it highly effective for treating acid reflux, gastroesophageal reflux disease, GERD, and stomach ulcers. It is not used for high cholesterol, high blood pressure, or bacterial infections. When counseling patients, always confirm they understand the main purpose of their medication to ensure appropriate use and expected outcomes. Question 8. Which of the following is the generic name for the blood thinner Coumadin? I. Eliquis. B. Xarelto. C. Warfarin. D. Pradaxa. Answer C. Warfarin. This question directly tests your knowledge of essential brand and generic name pairings, particularly for high-risk medications. Coumadin is the brand name for warfarin, a crucial anticoagulant, blood thinner, used to prevent and treat blood clots. Eliquis, apixaban, Xarelto, rivaroxaban, and Pradaxa, dabigatran are other blood thinners, but they are newer direct oral anticoagulants with different generic names. Given the critical nature of blood thinners, accurately identifying warfarin by both its brand and generic name is extremely important to ensure patient safety. Question 9. What is the primary indication for prescribing amlodipine? I. To lower blood sugar. B. To reduce inflammation. C. To lower blood pressure. D. To treat bacterial infections. Answer C. To lower blood pressure. Understanding the main use of common drugs is fundamental for pharmacy technicians. Amlodipine, Norvasc, is a calcium channel blocker primarily prescribed to treat hypertension, high blood pressure, and certain types of angina, chest pain. It works by relaxing blood vessels, making it easier for the heart to pump blood. Amlodipine is not used to lower blood sugar, reduce inflammation, or treat bacterial infections. Knowing these direct indications helps you correctly verify prescriptions and provide basic patient information. Question 10. Which medication is commonly known by its brand name Synthroid? I. Prednisone. B. Metformin. C. Levothyroxine. D. Insulin glargine. Answer C. Levothyroxine. This question assesses your knowledge of brand and generic names for a frequently prescribed endocrine medication. Synthroid is the widely recognized brand name for levothyroxine, a synthetic thyroid hormone used to treat hypothyroidism, underactive thyroid E, by replacing the hormone the body normally produces. Prednisone is a corticosteroid, metformin treats diabetes, and insulin glargine is a type of insulin for diabetes. Accurately pairing Synthroid with levothyroxine is critical due to its narrow therapeutic index and the high prevalence of thyroid conditions. Question 11. What is the generic name for the commonly prescribed pain reliever Celebrex? I. Ibuprofen. B. Naproxen. C. Meloxicam. D. Celecoxib. Answer D. Celecoxib. This question tests your ability to match a brand name with its generic equivalent, specifically for a commonly used anti-inflammatory drug. Celebrex is the brand name for celecoxib, a nonsteroidal anti-inflammatory drug, NSAID, that is selective for COX-2 and is used to treat pain and inflammation. Ibuprofen, naproxen, and meloxicam are also NSAIDs, but they are different medications with their own distinct brand names. Knowing these specific pairings is essential for accurate dispensing and for distinguishing between different NSAIDs, especially when counseling patients about potential side effects or drug interactions. Question 12. Gabapentin is primarily used to treat which of the following conditions? A. Asthma. B. Diabetes. C. Seizures and neuropathic pain. D. High cholesterol. Answer C. Seizures and neuropathic pain. This question focuses on the primary indications for a frequently prescribed neurological medication. Gabapentin, Neurontin, Gralis is an anticonvulsant and analgesic medication used to treat partial seizures and neuropathic pain, such as postherpetic neuralgia, pain after shingles. While it has other off-label uses, it is not primarily used for asthma, diabetes, or high cholesterol. Understanding the main therapeutic uses of medications like gabapentin helps you recognize proper prescribing patterns and assist with patient counseling. Question 13. Which drug class does furosemide belong to? A. Thiazide diuretic. B. Loop diuretic. C. Potassium-sparing diuretic. D. Osmotic diuretic. Answer B. Loop diuretic. This question tests your knowledge of specific drug classes and their mechanisms, particularly for diuretics. Furosemide, Lasix, is a potent loop diuretic, meaning it works in the loop of Henle in the kidneys to increase urine output, effectively removing excess fluid from the body. It is often used to treat edema, swelling, and hypertension, high blood pressure. Thiazide diuretics, like hydrochlorothiazide, potassium-sparing diuretics, like spironolactone, and osmotic diuretics, like mannitol, are different types of diuretics with distinct sites of action. Recognizing furosemide as a loop diuretic helps anticipate its effects, such as potential potassium loss. Question 14. What common side effect should a patient taking amoxicillin be warned about? A. Constipation. B. Nausea, vomiting, diarrhea. C. Dry cough. D. Muscle weakness. Answer B. Nausea, vomiting, diarrhea. This question focuses on common side effects associated with widely used antibiotics, important for patient counseling. Amoxicillin, a penicillin-class antibiotic, frequently causes gastrointestinal disturbances such as nausea, vomiting, and diarrhea because it can disrupt the natural balance of gut bacteria. While other medications might cause the other listed side effects, they are not typically associated with amoxicillin. Advising patients to take amoxicillin with food can often help minimize these stomach-related side effects. Question 15. The brand name for fluticasone propionate nasal spray is A. Nasacort. B. Nasonex. C. Flonase. D. Rhinocort. Answer C. Flonase. This question tests your knowledge of brand and generic names for common over-the-counter and prescription allergy medications. Flonase is the well-known brand name for fluticasone propionate nasal spray, an inhaled corticosteroid used to treat seasonal and year-round allergy symptoms. Nasacort, triamcinolone, Nasonex, mometasone, and Rhinocort, budesonide are other corticosteroid nasal sprays but contain different active ingredients. Correctly identifying Flonase with fluticasone propionate is crucial for accurate dispensing and patient counseling, especially given its popularity. Question 16. What is the primary use of metformin? A. To treat high blood pressure. B. To lower blood glucose in type 2 diabetes. C. To reduce cholesterol. D. To alleviate pain. Answer B. To lower blood glucose in type 2 diabetes. This question assesses your knowledge of the main indication for one of the most common medications for chronic disease. Metformin is the first-line oral medication for type 2 diabetes, working by decreasing glucose production in the liver and improving insulin sensitivity. It is not used for high blood pressure, cholesterol reduction, or pain relief. Emphasizing its role in blood glucose control is key when counseling patients about this medication. Question 17. Which of the following is a common benzodiazepine used for anxiety? A. Fluoxetine. B. Alprazolam. C. Sertraline. D. Bupropion. Answer B. Alprazolam. This question tests your recognition of a common medication within a specific drug class, important for understanding its effects and controlled substance status. Alprazolam, Xanax, is a benzodiazepine frequently prescribed for the short-term treatment of anxiety disorders and panic attacks. Fluoxetine and sertraline are SSRI antidepressants, while bupropion is an antidepressant with a different mechanism. Remembering that many benzodiazepine generic names end in PAM or LAM can help you quickly identify them and recall their potential for dependence and sedation. Question 18. What is the generic name for the urinary frequency medication Flomax? A. Sildenafil. B. Finasteride. C. Tamsulosin. D. Tolterodine. Answer C. Tamsulosin. This question tests your knowledge of brand and generic names for medications used in urology. Flomax is the brand name for tamsulosin, an alpha blocker commonly prescribed to improve urine flow in men with benign prostatic hyperplasia, BPH, by relaxing the muscles in the prostate and bladder neck. Sildenafil treats erectile dysfunction. Finasteride treats BPH and hair loss, and tolterodine treats overactive bladder. Accurately pairing Flomax with tamsulosin is essential for proper dispensing and understanding its specific use in BPH. Question 19. A patient is prescribed simvastatin. Which of the following conditions does this drug treat? A. Diabetes. B. High cholesterol. C. Asthma. D. Depression. Answer B. High cholesterol. This question focuses on the primary indication for a very common cardiovascular medication. Simvastatin, Zocor, is a statin medication primarily used to lower high cholesterol levels by reducing the liver's production of cholesterol. It is not used to treat diabetes, asthma, or depression. Knowing that drugs like simvastatin, atorvastatin, and rosuvastatin all belong to the statin class can help you remember their shared purpose of cholesterol reduction. Question 20. Which of the following medications is a common selective beta blocker? A. Lisinopril. B. Amlodipine. C. Metoprolol. D. Furosemide. Answer C. Metoprolol. This question asks you to identify a specific drug within a particular class, a foundational concept for pharmacy technicians. Metoprolol, Lopressor, Toprol XL, is a beta blocker, primarily used to treat high blood pressure, angina, and heart failure by slowing the heart rate and relaxing blood vessels. Lisinopril is an ACE inhibitor, amlodipine is a calcium channel blocker, and furosemide is a loop diuretic. All are used for cardiovascular conditions but belong to different classes. Remembering that many beta blockers end in olol is a helpful mnemonic. Question 21. What is the generic name for the antibiotic Keflex? A. Ciprofloxacin. B. Azithromycin. C. Cephalexin. D. Doxycycline. Answer C. Cephalexin. This question tests your knowledge of brand and generic names for a frequently prescribed antibiotic. Keflex is the brand name for cephalexin, a first-generation cephalosporin antibiotic used to treat various bacterial infections, including skin, ear, and urinary tract infections. Ciprofloxacin, azithromycin, and doxycycline are other antibiotics but belong to different classes and have different generic names. It is crucial to correctly identify this pairing to ensure the right antibiotic is dispensed for the specific infection. Question 22. A patient is taking warfarin. What important dietary consideration should be discussed? A. Avoiding grapefruit juice. B. Maintaining consistent vitamin K intake. C. Limiting dairy products. D. Increasing potassium-rich foods. Answer B. Maintaining consistent vitamin K intake. This question addresses a critical counseling point for a high-risk medication, essential for patient safety. Warfarin's anticoagulant effect is directly impacted by vitamin K, which promotes blood clotting, so consistent intake of vitamin K-rich foods, like leafy green vegetables, is necessary to avoid fluctuations in its effectiveness. Grapefruit juice affects some medications but not warfarin. Dairy and potassium intake are not specific concerns for warfarin. Always advise patients on warfarin to maintain a stable diet and discuss any significant dietary changes with their doctor or pharmacist. Question 23. What is the generic name for the medication commonly known as Vicodin? I. Tramadol. B. Oxycodone. C. Hydrocodone/acetaminophen. D. Codeine/acetaminophen. Answer C. Hydrocodone/acetaminophen. This question tests your knowledge of brand and generic names for a common combination pain medication, often a controlled substance. Vicodin is a well-known brand name for the combination of hydrocodone, an opioid pain reliever, and acetaminophen, a non-opioid pain reliever. Tramadol, Ultram, oxycodone, OxyContin, roxicodone, and codeine/acetaminophen, Tylenol number 3, are other opioid or opioid combination pain medications but are distinct from Vicodin. Understanding these pairings is crucial for proper dispensing, especially with controlled substances, to prevent errors. Question 24. Which of the following medications is a proton pump inhibitor, PPI? I. Famotidine. B. Ranitidine. C. Omeprazole. D. Cimetidine. Answer C. Omeprazole. This question assesses your knowledge of drug classes used for gastrointestinal conditions. Omeprazole, Prilosec, is a proton pump inhibitor, PPI, which works by irreversibly blocking the proton pump to significantly reduce stomach acid production. Famotidine, Pepcid, ranitidine, Zantac, though largely Recaldi, and cimetidine, Tagamet, are all histamine H2 receptor antagonists, H2 blockers, which reduce acid production by a different mechanism. Identifying omeprazole as a PPI is important for understanding its efficacy and potential long-term side effects. Question 25. A patient asks about the difference between atorvastatin and rosuvastatin. Both are used to treat I. High blood pressure. B. High cholesterol. C. Diabetes. D. Heart failure. Answer B. High cholesterol. This question highlights the common therapeutic use for drugs within the same class, important for patient education. Atorvastatin, Lipitor, and rosuvastatin, Crestor, are both HMG-CoA reductase inhibitors, commonly known as statins, and their primary purpose is to lower high cholesterol levels. While they may have slight differences in potency or side effect profiles, their main indication remains the same. Recognizing that these drugs are in the statin class immediately tells you their primary function is to manage cholesterol. Question 26. Which of the following is the generic name for the erectile dysfunction medication Viagra? I. Tamsulosin. B. Vardenafil. C. Sildenafil. D. Tadalafil. Answer C. Sildenafil. This question tests your ability to link a well-known brand name to its generic counterpart for a specific medical condition. Viagra is the brand name for sildenafil, a phosphodiesterase 5 PDE5 inhibitor primarily used to treat erectile dysfunction (ED). Tamsulosin treats benign prostatic hyperplasia, while vardenafil, Levitra, and tadalafil, Cialis, are other PDE5 inhibitors but have different generic names. It's important to differentiate these medications as they share a similar mechanism but have varying durations of action and potential interactions. Question 27. What is the generic name for the blood pressure medication Toprol XL? I. Lisinopril. B. Amlodipine. C. Metoprolol succinate. D. Valsartan. Answer C. Metoprolol succinate. This question focuses on specific brand and generic name pairings, particularly for extended-release formulations. Toprol XL is the brand name for metoprolol succinate extended release, a beta blocker commonly used for high blood pressure, angina, and heart failure. It's important to distinguish it from metoprolol tartrate low pressor, which is immediate release. Lisinopril, amlodipine, and valsartan are different classes of blood pressure medications. Understanding the succinate part and XL indicates its extended release nature, which impacts dosing frequency. Question 28. Prednisone is a corticosteroid primarily used for its I. Antibiotic properties. B. Antiviral effects. C. Anti-inflammatory and immunosuppressant effects. D. Pain-relieving properties similar to opioids. Answer C. Anti-inflammatory and immunosuppressant effects. This question tests your understanding of the primary actions and uses of a very common and versatile medication. Prednisone is a powerful corticosteroid that works by reducing inflammation and suppressing the immune system, making it effective for a wide range of conditions like asthma, allergies, autoimmune diseases, and skin conditions. It does not have antibiotic, antiviral, or opioid-like pain-relieving properties. Recognizing prednisone's anti-inflammatory and immunosuppressant roles is key to understanding its diverse applications and potential side effects. Question 29. A patient is prescribed ciprofloxacin. This medication is classified as an I. Penicillin. B. Macrolide. C. Fluoroquinolone. D. Tetracycline. Answer C. Fluoroquinolone. This question assesses your knowledge of antibiotic classes, which is crucial for understanding a drug's spectrum of activity and potential side effects. Ciprofloxacin, Cipro, is a widely used antibiotic belonging to the fluoroquinolone class, known for treating a broad range of bacterial infections, including urinary tract, respiratory, and skin infections. Penicillins, like amoxicillin, macrolides, like azithromycin, and tetracyclines, like doxycycline, are different antibiotic classes. Knowing ciprofloxacin as a fluoroquinolone also alerts you to specific counseling points, such as potential tendon issues. Question 30. Which of the following is an expected side effect of taking the diuretic hydrochlorothiazide? I. Low blood sugar. B. Muscle cramps due to electrolyte imbalance. C. Weight gain. D. Constipation. Answer B. Muscle cramps due to electrolyte imbalance. This question focuses on recognizing a common side effect of a frequently prescribed diuretic, crucial for patient safety and counseling. Hydrochlorothiazide, HCTZ, is a thiazide diuretic that increases urine output and can lead to the loss of electrolytes, particularly potassium, which can cause muscle cramps or weakness. Low blood sugar, weight gain, and constipation are not typical or primary side effects of HCTZ. It's important to advise patients taking diuretics about staying hydrated and reporting any signs of severe electrolyte imbalance to their doctor. Question 31. What is the generic name for the common heartburn medication Nexium? I. Omeprazole. B. Lansoprazole. C. Pantoprazole. D. Esomeprazole. Answer D. Esomeprazole. This question tests your ability to identify brand and generic names within a closely related drug class. Nexium is the brand name for esomeprazole, which is an S-isomer of omeprazole and also a proton pump inhibitor, PPI, used to treat acid reflux and GERD. While omeprazole, Prilosec, lansoprazole, Prevacid, and pantoprazole, Prodinix, are other PPIs, they are distinct generic medications. Knowing these specific pairings helps prevent errors and ensures accurate patient counseling regarding their prescribed medication. Question 32. Cyclobenzaprine, Flexeril, is prescribed for which of the following conditions? I. Nerve pain. B. Muscle spasms. C. Insomnia. D. Anxiety. Answer B. Muscle spasms. This question tests your knowledge of the primary indication for a common musculoskeletal medication. Cyclobenzaprine, Flexeril, is a muscle relaxant primarily used for the short-term relief of muscle spasms associated with acute, painful musculoskeletal conditions. It is not indicated for nerve pain, insomnia, though drowsiness is a common side effect, or anxiety. When counseling a patient, Emphasize that this medication is for muscle spasms and may cause drowsiness, impacting driving or operating machinery. Question 33. The antidepressant Wellbutrin is known generically as I. Sertraline, B. Bupropion, C. Venlafaxine, D. Duloxetine. Answer B. Bupropion. This question tests your knowledge of brand and generic names for a commonly prescribed antidepressant with a unique mechanism. Wellbutrin is the brand name for bupropion, an antidepressant that works differently from SSRIs and SNRIs and is also used for smoking cessation as Zyban. Sertraline's Zoloft is an SSRI, while venlafaxine, Effexor XR, and duloxetine Cymbaldi are SNRIs. Accurately pairing Wellbutrin with bupropion is crucial, especially because it can have different side effect profiles compared to other antidepressants. Question 34. What is the generic name for the medication commonly known as Lantus? I. Insulin Lispro, B. Insulin Glargine, C. Insulin Aspart, D. Insulin Detamir. Answer B. Insulin Glargine. This question assesses your knowledge of brand and generic names for common insulin products, which is critical for diabetes management. Lantus is the brand name for insulin Glargine, a long-acting insulin used once daily to provide baseline insulin coverage for people with diabetes. Insulin Lispro, Humalog, Insulin Aspart, Novolog, and Insulin Detamir, Levemir are other types of insulin with different durations of action and brand names. Proper identification of insulin types is paramount to ensure correct dosing and prevent dangerous blood sugar fluctuations. Question 35. A patient is prescribed Montelukast, singular. This medication is primarily used to treat I. Acute asthma attacks, B. High blood pressure, C. Chronic asthma and allergy symptoms, D. Bacterial infections. Answer C. Chronic asthma and allergy symptoms. This question focuses on the primary indication for a common respiratory and allergy medication. Montelukast, singular, is a leukotriene receptor antagonist primarily used for the long-term management of chronic asthma and to relieve symptoms of seasonal allergies. It is not used for acute asthma attacks, which require rescue inhalers like albuterol, high blood pressure, or bacterial infections. It's important to counsel patients that Montelukast is a maintenance medication and should be taken regularly, not just during an acute attack.